Hello, all. This is Dr. Dheeraj Masapu, and today I would like to talk about the hypersaturation, which is going to start in 2025 and is going to continue in future. And I'm going to tell you why this hypersaturation is happening in medical field among the doctors, and the ways in which you can actually come out of this hypersaturation and succeed in your careers. So basically, that is the agenda behind this particular video. And let me tell you why the healthcare is becoming hyper competitive, particularly in metros. So the main reason is, see, every doctor who is specialized in a particular area, for example, if you take some surgeons or an orthopedic surgeon or a general surgeon, if you're a general surgeon, then most of them would actually want to be in the minimal access surgery, and all the orthopedicians would want to actually do knee replacements. So, and all the anesthesiologists would want to enter into intensive care, and like that, every like ophthalmology, if you take, and cardiology, and any specialty you take, everyone is trying to get into one area, and everyone wants to compete in the same area. So that is the reason we are only creating this hyper competitive, hyper saturation situation. Okay, so we are the reason for that. Anyway, there is anyway we created that now. So how, as in the individual level, what strategies that you have to adopt now to actually come out of it is what I'm going to tell you. Before that, I would like to tell you certain areas which are still in the initial stages and not become hyper competitive. So the reason being telling these particular areas is, now when I tell you, these areas might not look very attractive for you, but let me tell you, the engineers who are working actually on the AI and Nvidia company 10 years ago, maybe they were not given so much of importance like today, but now all those engineers are like multimillionaires with the shares of Nvidia. And not only that, in the engineers who are working on AI, who have significant experience in working in AI in other companies also, have a very good salaries at present. But 5 to 10 years back, that was not the case, right? So what I'm trying to tell is, the areas which I'm going to tell you now might look not so attractive for you at present, but those are the areas I think which might pick up in future, or at least if they're not picking up, they're not so hyper competitive. Okay, the one of the areas is in the neurosurgical area is functional neurosurgery, is where I see a very good future. People are working on the after neurosurgery. If you are working on deep brain stimulation, neuromodulations, and all that, there is a very good scope in future, because there are a lot of epilepsy cases and movement disorders and chronic pain who will require this area of functional neurosurgery. At present, if you're exclusively sticking on to this area, you might do less practice, but in future, the advancements are happening in this area, and it is going to boom. Okay. In the same way, the next area would be, if you are a pediatrician and working on pediatric oncology, particularly the leukemias and pediatric brain tumors, lymphomas, and all that. So at present, you might think that there are less number of cases, but India actually has 50,000 new pediatric cancer cases annually are being reported at present. So there is very high, scope that very high chances that you can actually click in this area. And there are a lot of funds and everything being raised in this particular area, even for the research purposes. And a lot of newer therapies are coming, like immunotherapy, targeted therapies, and all that. So there would be a significant increase in the patient base in this particular area. And I always tell intervention radiology will have a very good future, because the many procedures actually in future would be done by interventional specialists. So I am looking at now actually a lot of fibroids and all those things in uterus which were getting operated in the past actually are being managed by intervention cases now. Not every case, but if it's a smaller one, they're doing it with intervention, and like that. So new indications would come in future, and there would be a significant increase in the number of patients even for intervention radiology in future. So not only this, There are certain other specialities like psychiatry, and if you specialize into geriatric psychiatry, who are working on dementia and depression and anxiety in older people, you will have a very good scope in future, because in India around 30 plus crore people would be there in 10-15 years down the line, because most of the people are becoming old, right, in India. So even though our mean age is 27, but by another 10-15 years, around 30 crore plus old people would be there, and we require a lot of geriatric psychiatrists. Interventional pulmonology is another area which is picking up now. Now you might think that the number of cases are less, but in future they will have a lot of solutions for many common lung disorders. So I feel you can expect anywhere, the requirement would be 2,000 to 3,000 specialists in this particular area would be required for India alone in future. Okay, and rehabilitation and PMR is a very good specialty, but if you are focusing on onco, it would be a very good segment in rehabilitation. And post cancer is the area that you need to focus on, and the demand would increase in future. And I feel thousands of people would be required, anywhere between 2 to 4,000 people would be required in future, and you can actually claim a very good salary if you specialize in onco rehabilitation. And infertility is already booming, but still scope will be there in future, because more and more people are suffering with infertility in India, and that number will increase in future. So even now, if you enter, you will have a very good future in infertility after OBG. Okay, palliative medicine also will have a very good future, and sports medicine and emergency trauma medicine and all those fields also would have a very good future. So these are the different areas where at present hyper saturation is not there, but eventually these areas also would become saturated. So but still then at present they're not very saturated. So now I would like to tell you some of the ways in which actually you can build a very good patient base. So number one thing is you have to establish a loyal clientele, and that can be built only by patient satisfaction. So whichever field you are in, so I will tell you 10 steps that you need to stick on. Number one is patient satisfaction. You have to focus on patient satisfaction, and if every patient consistently, if you are giving satisfaction, and if you keep that as a single metric that you are focusing on, you will build a very good patient base. You actually don't have to go for so much of marketing also. Your patients only will get more patients for you. So even in a hypersaturated market, by following this strategy, by giving full service to the patients, by improving the satisfaction, you can build more patients. Okay. The next strategy is please stay in metros, because action is in metros, the population is in metros, the equipment is in metros, and infrastructure is there, and more immigration is happening from rural areas to urban areas. So if you stay in metros, since the population is more, even if you stick on to a very niche area where the number of patients are less, you can actually attract more people. And so I recommend staying in metros and start with a junior position and gradually grow. And then it makes sense to shift the hospitals, and a lot of new hospitals are coming up. You can, after attaining some 3 to 5 years experience as a junior, you can shift as a senior to another hospital. 3 to 5 years work as a senior, then you can take a leadership position in another hospital. Like that, you have to plan your career in any specialty. Okay, you can actually grow very well in metros. And the next important aspect is you have to stay to one niche. You can't tell that you are a specialist in every area. You have to focus on one area, and then you have to position yourself as an expert in that area, and then you can organically grow in that area. So about the social media, I would like to comment here. Now NMC is actually coming up with a lot of rules and regulations. Many doctors actually don't know about these things. See, you are not supposed to actually market your clinic or hospital in social media. They're very strict with this. And the second thing is the patient testimonials, they're not allowing now. Okay, please don't put patient testimonials. And then the number 3 is, if you're planning to make videos, then they have to be educational content only, and your hospital details or your clinic details shouldn't come there. So if you follow these things, then maybe you can actually go for social media. Okay, anyway. So the next important thing would be, you rather than going into social media, which anyone can do, what you have to do is you have to think unique. Okay, maybe you can develop some AI driven tools, maybe you can develop an app which people can use and get benefited, and then through that maybe you can attract patients indirectly. You have to think something like that. Directly going in social media and telling people that you are the best, I don't think that's a good strategy. And anybody can do so. Think unique, think innovative, and then maybe you can find some way. You have a lot of engineering friends, right? For your school friends and all that. Just talk to them and tell them that this is what you do. They themselves will tell you some solutions, and you can actually work with them and build something, and try solving a problem of patients, and then they will start using that. And directly, you will become famous. So AI and technology is one area I think you should start exploring. And the next important thing is you have to build a personal brand. So building a personal brand, again, see, without using social media, you building a personal brand would become difficult. So maybe if you want to build, what you can do is you can start educating people about some particular disorder. Like if you are, for example, if you are an OBG specialist, then start educating people about what is infertility and what are the different ways of having IVF, what are the different ways of IVF, what are the problems of IVF. You can educate like that. Okay, maybe you can do some videos like that, but don't please show the patient testimonials and all that, because that will be caught by NMC and you will be stuck in some serious issues. There are certain rules in NMC where they might actually cancel your degree also. Okay, and next is understand finances also. So even it's not about earning, it's all about how you invest your earning and how you actually save your money. All those things also need to be taken care, because see, if you actually manage your finances better, then you will not have any financial obligations. So you can focus more on actually building your brand, doing research, improving the quality, and doing patient care. You will not have any kind of pressure actually. Okay, so understand the finances and taxation systems and invest your money wisely, and that is what I can tell. So, and the final point would be, please strengthen the CVs. In Indian CVs, I am looking at most of the CVs which are not on par with international level. I'm not talking about everyone, but at least 95% of people. 5% have very good CVs who are from central institutes and all that. So what I recommend is, you please build your CV. If you have a very good CV, you will get a very good opportunity in Middle Eastern countries, Australia, even USA. In alternate entry pathway, you can get jobs where you can earn good salaries. If you work for 7 to 10 years there, you can actually retire after that. So you have to think about publications, audits, quality improvement projects, and all that. So these are the different ways you can actually develop and come out of this hyper saturation or hyper competitive zones. If you are working in in some areas which are hyper competitive, otherwise choose the areas which I have already told you before, which are not so hyper competitive. And otherwise, if you are in hyper competitive zones, then this is the way you need to actually build your patient base. So these are my final thoughts. So what I really feel is, so hyper competitiveness is a challenge, and you have to accept that. You have to come out with innovation and creativity, and focus on niche areas and adopt innovative practices, prioritize on patient satisfaction, and you can actually have a very, very successful career in future. Okay, so I want you to shape your legacy in 2025, and the healthcare is going to evolve, don't worry, and it is going to evolve into in a very, very, very superior next level in future. And the Indian healthcare is going to actually become one of the best in the world. So good luck for you in 2025. Happy New Year.